You are listening to the Speech Space Podcast, a podcast full of tips and resources for SLPs. I'm your host, Jessica Cassidy, and this is episode 19. Hey everyone. Today I'm here to talk about preschool stuttering and when to intervene. But before I get started, I just wanted to give you guys a quick reminder that the digital SLP membership site has launched and the price is going to be increasing at the end of the month, which is October of 2017. So if you'd like to take advantage of the low rate being offered, where you get almost a 50% discount that is locked in forever, meaning that the price of the membership does not go up as the resources grow, then you can do that by jumping over to the speechspace.com/digital SLP. I will link to that in the show notes. And also, please stick around to the end of today's episode to learn about the freebie that's going to be offered in conjunction with the episode. All right, let's go ahead and get started. Okay, so I wanted to just start off with some quick stuttering facts. So about 1% of the population stutters. So in the United States, that would mean over 3 million Americans stutter. And developmental stuttering typically arises between the ages of 2.5 to 4 years old, although of course it can start later than that, but that's just normally when we see it emerge. Stuttering is 3 times more common amongst boys than girls, and stuttering severity can vary greatly from day to day, week to week, month to month. There can be periods of remission and certainly flare-ups as well. Okay, so before I jump into exactly when we do intervene, I would like to share a quote from ASHA. Now they say, "Disfluencies are not necessarily a problem. However, they can impede communication when a person produces too many of them." So I really want to stress this to all the SLPs listening because I think it's important that we pass the first part of this message on to parents and any older children or adults that we work with. And that was, disfluencies are not necessarily a problem. This is true. Stuttering is a benign, although very frustrating thing. But if we treat it like it's this big, awful problem, then the more we're adding fuel to the fire around the anxiety about speaking that often occurs in people who stutter. So when a young child who stutters is brought into our office, what do? Since it's pretty much impossible to determine which cases will spontaneously resolve, which a lot of them do, we need to try to predict the likelihood of the stuttering becoming problematic. Some things that you would want to consider when making that judgment would be things like, is there a history of family stuttering? Has the stuttering continued for 6 months or longer? Did the child begin stuttering after age 3.5? Does the child have a speech or language disorder? How does the family feel about the stuttering? Are they overly concerned or do they have strong fears about it? Is the child frustrated by the stuttering? And is the stuttering so severe that it's affecting the child's ability to communicate effectively? And I just want to put in a little disclaimer, a little side note there. Stuttering severity does not necessarily predict who will continue to stutter and who will not. So by throwing that one in there, I wanted to clarify that because I think that's important to remember. You can have very severe stuttering and have it just completely vanish. And you want to keep that in mind. But perhaps coupled with some of these other risk factors, it would be relevant to that child that you are seeing. So I did feel that that was an important one to throw in there. Now, there's no single factor that can be used to predict whether a child will continue to stutter or not. However, if you answered yes to many of those questions that I just spouted off, then obviously that makes a stronger case for starting therapy versus not starting therapy. Unfortunately, there is no magic formula where if you answer yes to this question, then do X, Y, or Z. However, you use your clinical judgment based on the answers to these questions to help you determine what the best plan of action would be based on the individual child and their family. So for example, let's explore for a second here, a hypothetical case. So say a 3.5-year-old boy was brought into your office and he'd been stuttering for about 3 months, had no family history of stuttering, and didn't seem the least bit aware of his disfluencies. It would probably be very reasonable to watch and wait with this particular child. On the other hand, if a 4-year-old boy came in with a positive family history of stuttering, who's been stuttering for about a year and was brought in with a parent who was very concerned, it certainly would be reasonable to go ahead and start speech therapy. So I hope that provides you guys with some clarity on this topic. Please feel free to reach out if you have any lingering questions. I've put together a nice little handout for you to offer to parents of concerned children who are stuttering that identifies characteristics that are more likely to be associated with stuttering and those that are not. It's a nice way to show them a little visual representation just to back up your decision to either proceed or hold off on treatment. And I really hope that you find it helpful. You can grab that by going to thespeechspace.com/podcast and locating episode 18, and then looking for the links listed in the links and resources section of that podcast is down towards the bottom. If you're listening on iTunes, you can pull up the show description, and there should be a link right in there that you can click on, and it will take you directly to the specific podcast that I'm referring to. So thank you for listening, and I will chat with you guys next time.